Hi, my name's Bertrand Dirk, and today we'll be discussing about occipital neuralgia. We'll discuss about what occipital neuralgia is, and hopefully you'll have a clear understanding on whether or not you do in fact suffer from occipital neuralgia. Now, occipital neuralgia is a medical disorder that presents with piercing, throbbing, or electric shock-like chronic pain in the upper part of the neck, back of the head, and behind the ears. For some people, the pain will present in the forehead, behind the eyes, or in the scalp. Now, occipital neuralgia is usually unilaterally, meaning it is only on one side of the head. The areas that are affected are directly associated with the areas innervated and supplied by the greater and lesser occipital nerves. Now, the occipital nerves are nerves that supply your brain with information regarding sensation and pain from the back of the head. This means that all sensations in the back of the head, neck and ears are reported to your brain by the occipital nerve. Sufferers of occipital neuralgia are often extremely hypersensitive and report that light stimuli, such as touching of the neck or the back of the head, can cause painful attacks, sometimes lasting as little as seconds or as long as minutes. Sometimes the sensation can feel like a sharp jab or an electric shock pain. This is due to the interneuronal connections between the occipital nerves and the trigeminal cervical nuclei. This is a region of the brainstem most commonly associated with headaches and migraines. Now, other symptoms typically associated with occipital neuralgia include pain behind the eyes, vision impairment, tinnitus, which is ringing in the ears, dizziness, nausea, and even a congested nose. Now, it is not uncommon for occipital neuralgia sufferers to go underdiagnosed for long periods of time or even misdiagnosed, as the symptoms presented can be similar to those with migraine headaches. One key differentiating factor between occipital neuralgia and migraine is the length of episodes of pain. Now let's talk about the anatomy of the occipital nerve. The occipital nerve is actually a group of nerves that arise from between the second and third vertebrae in the neck, which interact with each other. The greater occipital nerve innervates parts of the neck muscles as well as parts of the scalp. The lesser occipital nerve innervates the scalp and also around to behind the ears. There is a third occipital nerve, also referred to as the least occipital nerve, which innervates parts of the neck and areas down as low as the C2-3 joint in the neck. So, what is the cause of occipital neuralgia? Now, occipital neuralgia has many causes, and the occipital nerves are one of the largest nerves supplying the head and the neck. Hence, a common cause is the disruption of signals, causing the nerves to malfunction and then produce pain signals when the touch sensation is activated. So, occipital neuralgia may be a result of the occipital nerve from damage from surgery, brain lesions, stroke, or even trauma inflicted to the neck or the head, or some type of dysfunction in the neck itself. Other nerves, such as a disorder such as multiple sclerosis, can have also damaging effects to the myelin sheathing that covers the nerves and can cause occipital neuralgia. So, what can you do to help occipital neuralgia? If you believe that you have pain that is usually located on one side of the head and is usually at the back of the head, and you get a nerve type pain, a shocking nerve pain, or even a sharp stabbing pain, then you may suffer from occipital neuralgia. What we recommend is that you do seek a professional who is an expert in dealing with headaches and migraines and who understands what occipital neuralgia is. If you can get a definitive diagnosis that you do suffer from occipital neuralgia, then there are safe treatment options, non-surgical and non-medication, that can help with occipital neuralgia. For further information and for further clarifications, feel free to call us on 1-800-HEADACHE or email us. My name is Bertrand, and I hope you have enjoyed the presentation on occipital neuralgia. Thank you.